and our sheriff's department. Under Sheriff Thompson has and is here, I believe, is taking a new journey of retirement, I believe. So I'll turn it over to Under Sheriff Thompson to share a little bit about his next journey, next step, leaving the sheriff's department. Is that correct this year?
That's correct. Um, on June 19th, I'll be retiring from the sheriff's office and civilian law enforcement after just a bit more than 29 years in the civilian side and almost 35 in total. Um, so what I really do is I want to thank you for the time that I was allowed to spend as part of this board and part of this community that has done so much to advocate for those that need the assistance within our agency and within the agency of Spokane County, our civilian agencies and partners, but more importantly, the citizens that need it most. Um, with my departure, Sheriff Knowles has selected my replacement, uh, and that's Under Sheriff Kilstead, who's also here at the meeting today. He'll be taking my spot after this meeting today on this board, and his information has already been submitted to the county for that an appointment. So from the bottom of my heart, thank you very much for working with me over these years, and I look forward watching you have with your continued successes.
Chris, thank you very much. Thank you for your service and certainly welcome to your upcoming retirement. May you enjoy it thoroughly.
Thank you very much.
Yes. From the county's perspective and from the ASO, we do a lot of work. Behavioral Advisory Board not only represents the behavioral health work done by the county, but also a lot of advisory capacity where we provide guidance to the board on decision making. And then also for the undersheriff, well, and your role as undersheriff to the sheriff, you've also provided invaluable feedback and leadership to the team. Thank you for your time, commitment, and dedication to the county, to the citizens of our region, and for our Behavioral Health Advisory Board. You'll be missed. Not that we don't value and very much support Under Sheriff Kilstead's appointment. I look forward to that, but Sheriff Thompson, we have very much enjoyed having your leadership, your insightful thoughts and feedback to this group, as well as continued partnership. So thank you.
Thank you very much.
And 35 years, it's just a small stint in public service. So not, that entire, 3 decades of commitment to this community. Thank you. And then to his statement on our next representative from the Sheriff's Department, Under Sheriff Kilstead, we do believe that this will come up to the board for vote next week. So it is formality for the board for appointment. The sheriff is already nominated and the board has already indicated a vote. So we do look forward to that. Officially, we do have to wait till this got on their agenda. So want to open this up to the undersheriff if you want to share anything about joining the BHAB and moving forward.
Sure. Thank you. Can you hear me okay, Justin?
Yep.
Okay, good. Thank you. I was having some issues trying to log in. Thanks for having me on board. It's going to be a great change. Just some real quick background for me. This is my 30th year in law enforcement as commissioned. I had a couple of years before that, folding DARE shirts at the DARE office for the city, going way back. And when I was a work study, finished out my degree at Gonzaga University. I lived in Spokane my entire life. I graduated from Shable Park, went to Gonzaga, started here when I was 21, and have never looked back. And it's been a fantastic ride. I've got several more years to go because I did start pretty young. So I really look forward to being a part of this and moving into the investigative division from the patrol division, which I currently command right now. So I'm sure we'll have time to meet and get to know each other better as time goes on. But thank you very much for having me.
Thank you. Welcome.
Excellent. And if it pleases the Behavioral Health Advisory Board, I'd also like to introduce our other newest member, actually not new, has been in the process for some time, so our sincerest apologies. It's taken a lot of time for the board to be able to put requests forward for any appointment that includes for various areas in the county. So it's not just our newest member having to go through that process, but now we've gotten through the backlog of requests. Our new member, Karina Love, comes from the community. Not only someone who works actively, but also someone who's experienced and has various different background within the community, both from the service side as well as from lived experience with other individuals. So I want to turn this over to Karina. Welcome to our Behavioral Advisory Board. It's taken some time to get you to this point, so I appreciate your patience with the board's appointment, and I'll turn it over to you for anything else you'd like to add.
Thank you. Well, I am currently a FCS, Housing and Employment Specialist. And on my spare time, I like to go downtown and pick people up off the streets and bring them back to my church and feed them and give them resources. And why I think this is a significant thing to me is I'm also a fentanyl survivor. In August, I have 2 years. And since those 2 years, I spent a year homeless and CPS case, name it, I've probably been through it. Well, now I'm giving back and I'm guiding people through the 2 resources that could help people change their ways. And I'm going right downtown and building bridges, not only with people out on the streets, but my goal is to build bridges throughout the community, because I think the more of us that we work together as one in our community, the resources working together as one, will be able to solve more solutions for people. So I really have a dream to unite our community from resources to the community on the streets. So that's me.
Excellent.
Welcome, Karina. Thank you very much.
And Kim, there is various other individuals that we have put forward to the board, as well as other changes that may occur in the future. Just recognize
Perfect.
for those as part of the process, we're beholden to the Board of County Commissioners for the selection and appointment. So I do apologize if there is a delay when we put those names forward, or there's interviews, and when they are finally put forward to the BHAB for introduction. So that's just a note to put out there. There will always be a couple weeks delay for the appointment and then the formal acknowledgement of membership of the BHAB.
Sounds good. Not a problem.
So Justin,
All right.
Kim, do we need to make a motion to vote on Officer Kittlesvitz? I can't say your last name, to replace Officer Thompson?
As a point of order, the Board of County Commissioner reserves under the charter the full right of appointment. So BHAB, although does get to do the introduction and recognition of their appointment, it's only after the board has already made the determination. So it is something that they have reserved that right for in the future. If it's something that that fits within the statute, and that's really what we follow along, that's something to consider with the board. But they will vote on it formally, I believe, on the 10th is when it goes before the board for final appointment.
Okay. Thank you. I want to make sure I wasn't slacking.
Yeah, no problem. As a means of motion, however, could I have a motion that we welcome both new members today? And again, welcome, or not welcome, excuse me, to wish Chris in a happy retirement. May I have a motion from the board member? Beautiful. Second? Perfect, Gail. Thank you. Yeah.
And Chris, nobody ever
motion
retires.
approved.
We'll see you.
Yeah. Yes. Welcome, Under Sheriff. Welcome, Karina. And again, Chris, good luck to you in your next adventure.
Thank you, Kim.
Morris needs your help over at Neighborhood Watch.
Yeah. All right. Before we go on to the presentation, let's do a quick review of last meeting's minutes for any changes or errors needed, or any errors and changes needed. And if you had a moment to take a look at those, could I have a motion to approve?
A motion to approve. Reviewed it.
Perfect. And then a second?
Second.
Sounds good, Jackie. Thank you. All right. We'll just go with any disagreements with the motion? Perfect. All right. Mr. Kent, thank you for being here today on behalf of STARS. Ryan, we're going to go ahead and turn the floor over to you.
All right.
Thanks for being here.
No, thank you guys for inviting me. I just wanted to personally thank Karina for sharing her story. Thank you for what you're doing for the community, and couldn't agree with you more. You guys are doing a great job on this board, and yeah, just appreciate being able to come and share a little bit about our program. If you're not familiar with STARS and our sobering and triage program, we have it's called Sobering, Triage, and Transition Program is the program, or STAT. If you're not familiar with sobering can be for individuals who are under the influence, like acutely under the influence, intoxicated. Currently, I believe there is no other place except for through like emergency personnel for someone who's intoxicated to get into a service. That's been an issue for a while for individuals to be able to get into a program or go somewhere while they're intoxicated, whether it be treatment or shelter or whatever the hospital, whatever the case may be. So with our program, one thing that is unique with sobering is the ability for individuals to come into sobering and in the same building be able to go up into other levels of care, most of the time being withdrawal management, or known as detox. It's just right up the stairs. You get a warm handoff. They get that exposure to treatment, to staff, just from the very beginning. And motivational interviewing can occur with individuals that are unsure if they want treatment or not. And in most cases, as our statistics show, they do decide to move on to either withdrawal management, detox, or some other type of level of care or service, which is it's actually a really great stat that I can share with you guys here in a little bit. That we've had sobering services in the past, but they haven't produced results like this. Typically, you see duplicated patients a lot more, or we used to in our other sobering program, and we're seeing a lot less duplicated patients and a lot more that are going on beyond sobering services and sobering and triage services. So basically triage is kind of what it sounds like. Anybody that comes in to our Cali location will have access to case managers to help them with anything that they need, help them navigate the system in terms of if they qualify for Medicaid, we can help them get on Medicaid. If they need medicated assisted treatment or MAT, we can get them same day appointments, and typically same day scripts. If they're in transition from one treatment program to another, if they need a place to just hang out for a little bit, we got a spot for that as well. And it's a program that we've been developing along with Justin and his team and their help in guidance in some areas to create I believe create a program that is set sets people up for success from the get-go, because it's really hard for an individual to say that they weren't at least given the opportunity, if they make it in the door, to go on and get services from there. If anybody has a question about our services at any point, please feel free to jump in, ask a question. I'm better that way. I like answering questions, but I will continue giving information for a little bit. I do want to give you guys some of the stats that I was talking about. We've had 514 clients since December, and of those 514 clients, only 8% were duplicates, and I think that comes out to like 37 people total or something like that, which is in the past it was more like 50 or 60% duplicates. So we went from like 50 to 8%, which is pretty impressive if you're measuring from that standpoint. We've been holding steady at between 74 and 81% transfer to just withdrawal management or detox, which means that's not including anybody that comes into sobering that may have a bed date at another facility, or for whatever reason they prefer treatment somewhere other than at Spokane Treatment and Recovery Services. So the between 74 and 81% over that time period since December, that amount have gone into just withdrawal management. So it's a little bit higher if you count individuals that have gone on to treatment. Gail.
Yes, thank you. My question is, what are you referring to when you say duplicates? Is that people who are cycling back through?
Correct. Yes.
Okay.
Individuals that have come in that have been admitted more than one time.
Okay.
Sobering, typically you see really high rates of that. Just, it's in most cases, the very, very, very first step that somebody kind of encounters treatment, and they are usually or almost always intoxicated while that's going on. So good question. I get caught up in it's just the terms that we use in the field, and so we have had let's see, I just wrote this down right before the meeting. I want to give the number of individual. Basically, if you want medicated assisted treatment, if an individual wants medicated assisted treatment and they come into sobering and triage services, they will get it. 100% of individuals that have come into our services that have asked for it, that have stayed approximately 8 hours is about how long it takes to get an appointment and their prescription. If they stay that long, then they will get medication for, and that's not just necessarily for opioids. It could be for other substances as well. Jackie, your question?
Yes, the address to the facility. Where is it located?
It's located at on Cali. It's 6. Wow, now I'm drawing a blank right now. It's on our website.
602 West Cali.
There we go.
Perfect. Thanks so much.
Yeah, it's the old Daybreak
from Brownstone.
Yeah, it is. It's the old Daybreak building.
Yep.
And you can find it. You can find it on our website. You can find it at our main location. We have signs at all of our locations explaining where it's at, along with the address. So if someone doesn't have a cell phone or some way to get a hold of us, they can just read the signs and get there. We have a doorbell, so you don't even have to call us. You can just walk up and ring the doorbell, and we'll take you from there.
Ryan, this is Kim. What do you attribute to the significant decrease in duplicate patients? So said differently, what do you attribute to the significant increase in individual non-duplicated patients?
I don't know if there's necessarily, 628 South Cali. Thanks, Justin. I don't know if there's necessarily has been an increase of non-duplicated, but there's been a decrease in duplicated. And I attribute that 100% to just the ease of access from triage, with the case managers working with individuals, trying to figure out what hurdles they have in their way and helping eliminate those. And then the fact that withdrawal management or detox is just up 15 stairs from where they're at plays a huge role in that. And beyond that, their access, if we want to start getting more into success beyond that, there's that access as well. So we're in the process of renovations right now to provide additional levels of care in the same facility, and at hopefully around this time, 2 years from now, we'll have most levels of care, I would say most main levels of care that you see people go through in the same facility. So that's, I think, that will also increase long-term success rates for individuals entering sobering from the get-go. But that's right now, just having that access to withdrawal management. And we have really great counselors and case managers up in withdrawal management as well. So nobody leaves withdrawal management without an assessment and a referral to treatment if they want it. They pretty much all get an assessment anyway. That also brings me back to sobering. You can get an assessment in sobering as well. So if an individual, we see this sometimes, they still might be debating on whether or not they are ready for treatment or not, or want it. We can always do an assessment, and that way they have it for when they are ready, and then all it takes is an update, and they're ready to go on to that level of care that came out of that assessment. So it's the same thing in sobering as well. If somebody wants an assessment when they come into sobering, then we have a provider available to give them an assessment in every case as of now.
Got it. Any plans in the works or consideration for kind of having services again for adolescents, sobering services for adolescents?
There's always been considerations, and we're still, withdrawal management wise, we are still licensed to do so. The costs associated with it right now are prohibitive. But it is never something that we wouldn't consider, for sure. And I'm very, very, very familiar with the fact that, there's not a whole lot of youth spots available right now, and we want to be a part of the solution. It's just, we got to find out how to fund it appropriately and make it sustainable. So, Justin, did you want to say something?
Yeah, just to add some clarity here, to, at the expense of being too wordy, on top of Ryan, sorry, provide information. STAR's STAT program is the only one in the community that currently allows for a walk-in, same-day engagement that provides wraparound care, including a triage and assessment and same-day MAT treatment if necessary, in conjunction or integrated with the long-term care for either withdrawal management, meaning the next step of treatment for the ASAM level, or residential treatment. All of those connections occur. There are other facilities that do treatment services, and there's certainly other facilities that do immediate. The number one of those being the ER. But we yet to have a facility other than the STAR's current one that provides that immediate care, regardless, and I want to be clear on this, regardless of your insurance coverage. That is not a barrier to get into the facility. Regardless of your referral source, you don't have to be referred by law enforcement. You can walk in. And regardless of whether or not you have one or other substances on board, other facilities will omit them. Now, there is always an issue of medical stability as well as comorbidities. If you currently have a kidney disease where you're required to have some sort of dialysis, obviously that's going to be a challenge, and you should be seen at a facility that is medically able to stabilize you first. But STAR's the only one currently until we get our long-term plan, and it represents one of the four pillars of our current plan to address the opioid crisis in the community. So it is one of the only ones, including which the city and fire department are utilizing quite heavily. And since its inception, we've only had 6 beds, 6 triage chairs, so 12 overall, and filled without any sort of notice to the community. I know we've shared on this before, but the success for this facility, which we're now pushing forward in Spokane City primarily, is what we're trying to do and replicate across our 6-county region. But because of the need within this, just in Spokane City alone, has overwhelmed our capacity to be able to take on more. We do plan on expanding. Just want to highlight that, though. As you look in the community, it is unfortunate that we are medically underserved to the extent at which we can't provide the level of care necessary to really meet the need that exists. So, again, wanted to just throw that out there in terms of the full scope there. Ryan did a wonderful job sharing on STARS.
Thank you. Yeah, I just to add to that. Also, we will take individuals that that are experiencing some SI or suicidal ideation, just not with a plan. So that's kind of unique as well. Most, or I guess I don't want to speak for all of the agencies, but most agencies will not take people with suicidal ideation, but we are able to do that just as long as it's not an active plan. Gail, do you have a question?
I do. So do you provide the MAT treatment in-house, or do you work in partnership with another treatment provider?
It's a partnership with another provider. We've had it in-house before, but the partnership that we have is actually faster than in-house. So we just switched to fully working with that partnership, and it's a really good partnership that we have. It's with MultiCare. Well, there's actually more than one partnership, but MultiCare is the main one. It's gone so well for so many years that they are actually paying for 1.25 FT full-time employees specifically for the management of the MAP program. So they are helping provide services as well, just to make sure that people that come into the service are getting the service that they need in a fashion that they need it, which is quickly.
That's great. Thank you.
Mm-hmm.
Well, I just want to say thank you for your service. I've worked in this capacity and interventions and counseling now for going on 40 years and been through several of the sobering units that we've had. And I want to thank you and everybody that works for you. And I want to thank Justin and his entire crew who has aggressively gone out and eliminated barriers and fought for the people. So having worked with you guys diligently and got to know your people over the years, where I would call and go, hey, can you flip them for another 12? Because I can't get them in treatment, please. They're going to die out there. And I'm just so grateful and so excited to see all of the barriers that you guys have eliminated in this short amount of time. And I'm super excited for the future. So thank you both. Okay. I want you to know that.
Thanks, Michael. That's awesome. That really does mean a lot. I know Justin knows and his crew know, but this is a project that was uniquely attached to me, that I'm passionate about. That I wanted a program like this to be available since the day the original sobering unit got shut down. So it's really helpful to hear that. And yeah, thank you.
Yeah, Ryan, likewise, I want to say this, it's fantastic working with Joe and this team of folks that come to Sacred Heart Emergency every single day. So love working with those guys.
Thank you. That's really good to hear too. I'll pass that along to Joe.
Any other questions or comments from or for Ryan today?
Kim, this is Justin. Just one additional comment that I'd like to add.
Yeah.
Recognizing the work that's been done to expand this program that, again, provides services to the community regardless of insurance or ability to pay. The city has recognized the benefit this provides to the community and has agreed, the board will be reviewing this tomorrow, and the city tonight is what we're hoping to fund out another year's worth of expanded services at the full rate using their opioid dollars. So basically joining the county in their efforts, recognizing that creating their own would cause too much work and also would take away from administratively things that we've already put in place. So they're joining us. So we do expect the council will put forward about $400,000 that the Board of County Commissioners, based on the support that the BHAB has provided, will also invest more money that will allow for STARS to be able to expand a little bit more to meet that need. Now, we know long term, we don't want to put anything in place that isn't sustainable. The goal is to maintain this program with STARS, but also look at ensuring that STARS is made whole so that they have the ability to be able to provide the service and not just say, well, 1 year you're good and then take it away. That doesn't benefit the community, it doesn't benefit the people receiving the service. So we already have the next 2 years strategically planned with STARS, which included the joint partnership with Commerce for the purchase of the building. So I want to say under Ryan's leadership, they have and own the building. They have been consistently in the black in terms of maintaining their serviceability and are now looking at renovating the building to improve services, at least the decor, so it's not in the same building that, we had 13-year-old girls also receiving a service. The walls have a different decor in there. We need to update that for the current clientele and to improve as we look forward for the next 10 years. That is the best use of dollars. It's the best response to the individuals in the community and overall ensures that there's sustainability. So I appreciate everyone's kind words. If it wasn't for Ryan and his dedication of his team and the BHAB supporting this effort, we wouldn't be where we're at today. So congratulate yourselves as well as for Ryan, you and your team. Excellent work, dedication, commitment to the community and wanting to make this community a better place. Truly is where we're at today.
Thanks, Justin. Really appreciate that. It's an honor to be able to serve the community. It's our mission. And, anytime you have anything you guys want to ask or any questions, feel free to give me a holler and I'll come back on.
Sounds good. Thank you.
All right.
Ryan, I would tell you, apply to Mark Peterson and Extreme Team KXOY4 to help you remodel.
I have heard about that.
I have some
I got the
inside
wrong
information.
channel though. That someone told me the wrong channel and they're like, we don't have a program like that.
You have my number. Call me.
Okay. I might. In fact, I will. Thanks, Michael.
Sounds good. Yeah. Thank you. All right. Let's go ahead and move on to the next part of our agenda. Let's turn it over to the county for some block grant reviews as well as updates. And if you guys could also mention just the county commissioner, board of commissioners meeting was either, last month in May that we showed up to and had the proclamation read, that would be great.
Yes, I can provide all of that. For the section, giving you administrative updates on the block grant reports. Again, as always, I apologize in advance. Please stop me if I get too long-winded to go into too much detail. I tend to live in these reports, so I speak like the worst possible audible for a law journal. So if that tends to get too dry, just interrupt and ask me a question. But we'll give an update on the funds as per our agreement to have the BHAB sign off. Now, the BHAB signs off not on the money, as a reminder, but on the plan and services that we identify in the plan. And most of these, 98%, are continuation of services the BHAB has already agreed to. It's just the funding is maintained. We'll talk about what changes have been there. We'll also talk about some changes federally and statewide as it pertains to Medicaid and SAMHSA, which funds the block grant reports. As everyone's heard, SAMHSA may no longer be here this year, depending on what the House and Senate vote and what the president decides to do. And so, though, we'll give a quick update on that and then kind of give you a projection on do we anticipate any budget challenges or shortfalls. So we have some good news, some meh news, and then some bad news. So those are all areas we'll cover today. And then also, May represents the Mental Health Month. And for Spokane County, we had asked the BHAB to represent what we call Behavioral Health Month, or wanting to make at least a change to the name. Mental Health Month is generally encompassing, but kind of to a lesser extent diminishes substance use related issues. And Mental Health Week, which is a nationally recognized week, doesn't encompass everything for that entire week. So we decided to ask for the entire month and then make it behavioral health, recognizing the parity that exists with substance use related issues, as well as mental health, and then asking the board to recognize all the work of the providers in that area. We had our current chair of the BHAB, Kim, come and speak, as well as the executive director of NAMI. Again, this represents work being done across the entire arena. So we really wanted two of the key members that for the county is more conducive to the whole and not just a singular provider. We had a lot of providers call in and watch, but the board in April, oh, my memory shot, 20th, signed the Behavioral Health Proclamation recognizing the month of May. And we had the, lovely joy for both our behavioral health providers to sign in and recognize the work that both they do, as well as the work they're doing in the community for the citizens, but also the blessing to have both Kim and executive director of NAMI come and join us to share about that information. So that was absolutely wonderful. Kim, I don't know if you want to share anything specific about that, but we really appreciate your support and the recognition the board was able to provide regarding your representation of the advisory capacity on behalf of Spokane County.
I'll just say that was a wonderful opportunity. So thanks for allowing us to be there and be part of that.
No, it's excellent. And we also have the behavioral health conference coming up here in the next week or so. Just as a reminder for those that are here, although it's been a tight turnaround, we did announce this. We do have money set aside annually for any BHAB member to be able to go and attend the behavioral health conference. So if that is something you're interested in, maybe not for this year, for next year, because we are hitting against that. Just as a reminder, if you miss this, we will provide funding to support BHAB members, not to represent Spokane County, but certainly to participate and bring back advisory capacity to the BHAB that the board will then utilize. So we really want to heavily invest in that. So just don't forget that. And for those that are going, highly recommend your voice in representing our region as well. If there are no questions for that, I'll jump into our block grant reports. This is the drier part. And then I'll give you updates on other aspects administratively, and I'll turn it back over to Kim. So hearing none and seeing no questions, I'll jump right in. So Arlia, can you pull open the mental health block grant report? Now, there are some changes to block grant reports this year. When we started the year, we had anticipated that with the federal changes, there may have been reduction. And this was kind of the ongoing conversation, a 10% reduction. However, with our back and forth with the state and the fact that the Spokane Regional BHASO was the first ASO to negotiate the clawback and pay back the funds. So what a recognition to our region. We're able to also negotiate changes to our existing funding to protect the ongoing work that we're doing. And so you'll see in this block grant report that there are no changes to our annual allocation of mental health block grant dollars. So we haven't had to reduce anything. That is the good news. Long term, we can't provide any feedback to what that will look like in year 2026, but at least, for 2027, but for state fiscal year 2026, which begins July 1st, that benefits Spokane region because we don't have to reduce any funds. However, some bad news is we did have an increased need for some of the services in the allocated areas in the mental health block grant. We'll talk about that. So for planned narratives, Arlia, can you click that? We don't anticipate any changes overall to some of the needs and the expected gap areas within our region. So you'll see in this narrative, which is available and provided to the membership, all we did was identify the fact that there is, again, more limited services in our region for ongoing support. So it does mean that the critical gap areas that we're providing need to remain. So we identified that. We also identified the opioid challenges that we're experiencing in our community and the fact that we've had a lot of overdose deaths. And in conjunction with those, they're all co-occurring, meaning individuals have had the psychiatric component of that. So as part of this, we identified the co-occurring needs specific in our region. If you want to scroll down, keep scrolling. We also recognize that our region remains a region where individuals have been, even if nationally this isn't the case, historically we are a repopulation center for individuals who are seeking asylum or are escaping challenges within their own country. So we have a lot of unique populations within our region, specific to different languages. And so we've been very responsive to that. In fact, we represent one of the most diverse in terms of our ability to access language services. Big change last year was we changed to DES. And so anyone who utilizes our service has access to any of the contracted DES providers on the state. That is DES Washington is the Department of Enterprise Services. They oversee all the contracts specific to the various different state agencies. That's why you get DES as Enterprise. We have to log in with them, and then our agency gets specified under that. But anyone who receives a service that the state provides cultural or language services to that is contracted, we now have a contract with the state so that they can expense that without the individual having to find a unique or specific one. So they don't have to go to Language Link to get a service through us. They can just go through DES. As long as they're listed, we'll pay that bill and they'll get the service. So they have more choice and even less barriers. Good news. For the Behavioral Health Advisory Board involvement, again, all decision-making goes through our Behavioral Health Advisory Board. For programs, funding, of course, still remains a Board of County Commissioner. But as always, programs lead the funding, at least for our ability to identify them here. You'll see that specified. We also use our FISPERT, which a lot of members here are part of, as well as various other community collaborative events that we put forward, a lot of which probably spend way more time than, at least on my end, than we actually have accounted for because we have so many of them. Sometimes that can distract from the overall work we're going to do. But at the same time, we try to remove barriers for anyone to be able to access very specific areas to the services that may impact them or individuals that they either engage with or serve. So that's the section there. Again, what we've already provided. And the rest of this section as well is training, continue down, outreach, continue down. And the cost sharing portion, we provide these regardless of the inabilities to pay. So that's not a factor at all, but we do have to outline if we do. The cost sharing would only apply for those that have commercial insurance and they're paying for their copay. We pay for private insurance individuals' inability to pay their own copay for certain services prominently met. So long as the agency has a process for that, we'll pay for their share of their copay, even if they're already insured and that service is covered. Their insurance would pay for their portion of the service coverage. We would pay for their individual's cost sharing portion. It's unique. Not every region does that. So that's what we outline here. Summary and expenditures. Next tab. This just outlines the various programs where the money is going towards. This, again, does not outline the total amount each agency has contracted for, only sections within this that they fall under. So if you go to the top there, Aaliyah, each section outlines those. And we've talked about this at length. The primary portion of this is outpatient and medication management. Go all the way to the top, all the way to the top. And then it says specifically, we will pay this amount. We outline the provider. In the mental block grant, we're more specific than the SABG, but all it requires that we outline where it's spent at. We end up contracting the specific amounts in the contracts. They're one-to-one, but not as specific. So assessments, kind of like what we do for our STARS program. Every individual we contract with is able to receive an assessment at the place or service that is provided, so long as they meet the qualifications for the service under the agency's mental block grant funded allowance. So if they're not Medicaid and they meet the minimum qualifications for the program, they have no other funding source, then in this case, they would receive that service. So unfortunately, we're kind of that catch-all for everything after all gaps have been identified. So continue down. That includes direct services and outpatient, which is where the bulk of the money goes. Stop here. This is where there was some challenges. We saw an increased need with FPH that almost doubled the funding currently available there. I mean, the need outpaced the actual ability to pay those services. What we do anticipate come July 1st is that we'll be expanding out our general fund services. So the GFS, which is the state's other not assigned funding, we'll expand that out to over 450,000. So we're going to be doubling our ability to outreach for outpatient. Again, we did not anticipate this when we had originally opened this, because when Medicaid first came in, it wasn't a highly utilized one, but now we've seen that has increased almost twofold in the last year. So we'll be expanding that out. Group therapy will continue the current capacity, STARS being one of the primary ones, and then continue down. We also saw the increase in clubhouse services with FPH, which will be expanding to include for generally funded services from the state, flexible dollars. So just things to identify in the midst of this were the two main areas that we saw that we weren't able to fund sufficiently that we'll find other dollars for. Otherwise, the medication management is primarily for rural communities where they may not have access or there's a barrier to getting directly into treatment. So that's another area we put some money towards, and then continuing down, we put a lot out to the community support area as well. So that's where the vast majority of the funding went to. The next tab, the mental block grant co-responder. The state set aside funds here, and I want to remind the BHAB, we have not historically used these funds because it only applies these funds to a first responder agency. So law enforcement or fire does not allow us to actually give it to a behavioral health provider, and it's only $75,000. That's not enough to be able to fund a program. However, we have recognized that the BHAB has wanted us to put more money towards joint partnerships with fire. And I know it took a year to get me to this point, but come the 17th, we do anticipate that the board will sign the co-responder agreement with Spokane City to build out 4 teams of 2, a paramedic and a behavioral health provider with FBH, to respond within the city limits to behavioral health crisis. So that'll be 4 total of 8 members to respond to crisis, at least for 12 hours, 6 days a week. That's not enough for a 24-hour shift every day, 7 days a week, but we should see that it's with fire only at this point. So we'll be utilizing both their expanded BRU and CARES to support and enhance it. We aren't able to unlock these funds for that purpose because it limits it, but we've found other dollars under the county's mental sales tax to fully fund it. So not only are we using the taxpayers' funds locally more appropriately, but we're joining in a partnership with the city, which is always a benefit. As you've known, the city and the county tend to have challenges, demonstrates our partnership. One of the few areas that we partner. So that's why you don't see any money here actually being expensed, much to my frustration, but you're seeing that the program still will move forward. So that's the mental block grant. Any questions?
No, excellent job, Justin, and keep numbers on how much money we're saving.
As my grandfather always told me, why spend the money yourself so if you can have someone else pay for it? And we've had the vast majority paid for other areas. And the joint partnership with fire also lets them only expend the cost specific to the service being provided here. Everything else is expensed back to the city. So great news. And we're having the city give us money to pay off other programs that are joining with us. So wonderful partnership to be able to say, we give you money, you give us money. But I think the end result is this. The community actually sees the money go directly to people needing the service without having to squabble over whose responsibility it is. I just said, we'll do it. And I'll talk about that later, and they're following through. So it's wonderful to kind of push past all of the barriers that we're seeing. So that is the mental block grant. If there's no other questions on that, let's go to the SABG, or the new name, the Substance Use Prevention, Treatment, and Recovery Support Services. Although I like the name better than the SABG block grant name, that name comes out of a change that's happening nationally for where they're shunting the money. The question remains whether or not SAMHSA will remain to exist. If SAMHSA doesn't exist, it'll be called AHA, Americans for, something for a Healthier America? Something to that effect. Make America Healthy Again, MAHA. Either way, if SAMHSA does go away, they're not getting rid of the block grants themselves. The funding will still come down. So you'll start to see the name change to SUPTRS instead of SABG. There is no difference in terms of the service coverage or the respective individuals it's required to serve, just the name of the funding. So the actual plan itself, despite the name change, has remained the same, including the needs assessment, cultural competence. I won't go back over those again, because again, I already shared, similar to the mental block grant, we identified all those gaps and needs areas, just the primary one being the SUDP, and then the co-response stuff is, the co-occurring issues would remain the psychiatric component that isn't identified, right? So the primary is substance use. The co-occurring aspect is the psychiatric, whereas mental block grant, the primary is the psychiatric, with the co-occurring being the SUP stuff. So just switching with the primary is for the funding usage. However, in the needs area, we did identify a greater recognition of the fentanyl impact to our communities. So we did outline that, as well as the recent deaths in 2024 due to overdose. So that was a clear, more distinct area that we called out. For the funding allocation, we were able to convince them, again, not to change our amount. I had planned for a reduction. We didn't get that. So that's good news, but also mad that we don't know what will happen in 2027. There, I do anticipate some potential impact. Under the summary and expenditures, no significant changes here. In fact, as we discussed in our last block grant plan, the changes in allocation flowed more heavily to areas that we saw that the need existed, including the STARS, sobering, and triage. There was more need for immediate engagement than there was long-term. There was more need for prevention than there was for ongoing care. Once they get enrolled, we're able to find insurance. And so ongoing care was usually covered by either Medicaid or for a commercial plan. So we focus more heavily on prevention, outreach, engagement, and then after discharge from a provider, ongoing stabilization. So those are the areas that we focused on. All the funding in this section primarily remained the same, except for one, go all the way down to sobering. That's the primary area that we expanded for now, that will be primarily focused on under our contract with STARS for the services provided at their Cali location under the STAT program. Last year, we did increase funding for treatment programs, residential 3.5 level of care. And that was just recognition that some individuals who were provided that service at the time, we're seeing an increase in this, fell out of their eligibility for Medicaid. So we saw a need so they didn't lose that service. That was marginal compared to the sobering expansion. Otherwise, everything else remained the same. So no major changes here until 2027. I do anticipate we'll see some reduction. So that is the update. Same with the co-response. No need to give another update on that. Same matching dollars here. We did not include it, but we are already paying for it directly with fire. As you can see, this is what we get for the entire state fiscal year. $25,000 is not enough to hire anybody, even for a month, let alone a whole team for a year. And so instead of getting the administrative costs, it would cost $20,000. We just funded it elsewhere. If and when if I'm able to spend that, I will. I don't anticipate it anytime soon. So that is the SUPTRS plan. Any questions?
No, thank you, Justin, for that.
Yeah, absolutely. And that ends the updates on our plans. We do need a formal vote from the BHAB on both plans to proceed forward.
Okay. Do I have a motion? Well, actually, first, are any questions or comments for Justin?
I just want to say, Gail, he's coming for your title. If you're new on the board, it's not normal to have this amazing of people working with us, you guys. So Justin, you're phenomenal, fantastic. And having Gail, Justin, and Kim on this board has been incredible over the year. And I'm grateful for you guys. And I would like to make a motion to accept that.
A second?
I'll second.
Thank you. All right. Go with all in favor, but let's just do thumbs up or something. Any against, opposed? All right. Sounds good. Justin, Justin or anyone else from the county, any other comments or things you would like to review?
Yes, I believe that there had been a request to provide some updates on what is the projected impact or what are we hearing regarding federal funding and state funding, and then some recent legislative changes. I can give a quick update on that as well.
Okay.
If everyone want to hear that. And I promise I'll be succinct on this one. Every time I get better at being able to provide that. I usually have to lecture this out when I go to other places, so bear with me. This will be specific to behavioral health. I will touch on some areas in terms of medical coverage, but this is, again, a different space in response to that. So I don't have much information on that. So for behavioral health, we had a really busy legislative session. We anticipated there would be some cuts. And of course, we already informed the BHAB that we had to return $10 million for our region. But part of that negotiation was, if I have to give $10 million, and I anticipate that we had money that we couldn't spend because of proviso challenges, it would be sort of okay, but listen to us in this area. And that's how the state has worked. So 2 wins out of this that actually benefited the $10 million return. The $10 million return did not impact any ability to provide ongoing services. It did remove our bench in terms of being able to expand out new programs. We don't have a wider bench for that. But because we move a little bit slower when we put out a program to ensure that it's sustainable, we had some time to plan. So although we returned 10 million, and we did, part of the negotiation was, okay, but please don't reduce our future funding, so our ongoing allocation, and free up the remaining dollars for proviso so that if we don't spend one area, we can shift it to where the need exists. The state agreed to all of that. So they no reduction, and they gave us more flexibility. And then the legislature passed the engrossed substitute House Bill 1813, which further gave us ability to both expand our crisis response authority and designation for those services, for our ability to work with the MCOs. So that was wonderful. And it allowed us for greater flexibility to use funds in those areas. So practically, it still means we have to work with our MCO partners to ensure the service delivery. They are still designated by the state, so we work with them very closely. But this gives us more designation specifically on how those monies are utilized. Great, because it gives more response to the region's needs. And it also requires the state to be more responsive to crisis services. So thank you for all the support for 1813. We do anticipate more language in the future to come out of that. Reprocurement was not included in that. It was an initial part of the law, but that was ended up being removed. It deferred that plan would go back to the state for determination, but we do anticipate reprocurement. Now, reprocurement means that the current managed care organizations that oversee Medicaid services for the state of Washington would be reprocured or reselected through a process. We anticipate that would begin sometime in 2026 for discussion, with 2027 being the hard date for them to move forward. That's all conjecture at this point as the state plans. Part of that bill signed that they would be given some money and the authority to move forward with planning it out and submitting a report to the legislature. So that's all included. Additionally, the state also maintained funding for existing behavioral health, but did not expand it. So this is a hard kind of meh, as I indicated before. Obviously, we know that behavioral health has been underfunded for years. We don't believe the state has fully funded it to the need that exists, but we also recognize we're in a budget constraint. That being said, the MCOs are still in a challenging position, so are we. The need outstrips the current ability for the payment being provided to the state and from the federal government. And there's still a lot of stuff on the federal government side on whether or not they'll fully fund the state based on their rules. However, we do have a clear pathway moving forward. It means so long as everything moves forward without any penalties, we should be able to maintain existing funding for the current level of care. Wonderful news. But we do anticipate come 2027, federal and state fiscal year, there may be some impact. Now, under the current budget that we've seen, which has not been completed yet, from the House, from the federal level to the Senate, there are no overall cuts to Medicaid, but there are three components to Medicaid that could impact coverage. One of those is requiring work requirements. So individuals at a certain level would require them to actually demonstrate either they're seeking a job, that are working hours, or that they have some exclusion from that. The state anticipates that if those go into place, it could either increase costs for individuals to a certain extent or reduce roles. So that's one impact that we're tracking. The second one is that individuals would have more eligibility checks, meaning more letters going out defining, do you make the current limit for services, meaning financially, to receive the Medicaid benefit? And are you living where you're supposed to be living based on the address you put in there? Or you in the state of Washington versus North Idaho. If you don't respond to that, you could be removed from the rolls until you're able to. That they anticipate would reduce rolls. And then the third area is to strengthen the rules regarding who's eligible. And they won't reduce the overall rules for where an individual's federal minimum poverty range is, but the state could still augment what those ranges are. 217% or FPL or 180, I can't remember. But if they augment any of that, that could either change an individual's eligibility within the state or cause the state to cover it, but then the state would be penalized, reducing the overall amount, which would mean less benefit availability in the state. The federal government's looking at heavy rules against the state if they violate any of those provisions that could reduce hundreds of millions of dollars available to them for both medical and behavioral health services. So all things the state is grappling with that could affect enrollment. In the Spokane Regional Service Area, Eastern Washington, there's almost 300,000 people that receive Medicaid covered benefits. Half of those are children, if not more than half of those. So the impact would be significant, potentially the loss of almost 20,000 people in our region if all of those go through. So something to consider and think about. The healthcare authorities publish some things. So good news, at least for us right now, meaning we don't anticipate many changes, but long-term it could impact service delivery. So those are the major updates. I don't anticipate any other significant funding shortages. The county is also in a budget shortfall, but not for behavioral services. In fact, we've expanded and covered and continue to cover up to 330% FPL, meaning if you have commercial insurance and need a behavioral service at the SRSC, we usually and have the availability to fund those individuals. Something that no other region other than King County currently provides for their members. Again, a benefit, but something that would be the first thing that's cut because you look at crisis services first, emergent or urgent services, and then it's within available resources. So great news, great advocacy for our region. Part of the legislation also gave $3 million, $3,050,000 to the Spokane County for the expansion of the Crisis Relief Center, which when it's built will serve all individuals within the entire 6-county region, regardless of their ability to pay. Let them walk in and receive crisis relief and sobering. Again, further expanding out the work that we're doing with STARS and Ryan's team. But that really looks at the mental health component as well and allows them to walk in and does referrals from facilities like Ryan's or from ER. Desperately needed in terms of immediate, urgent services for those experiencing behavioral crisis. So all great news. We also have a federal request sitting before the House to include another $3 million allocation for the Relief Center. We feel good that we'll get something. I don't know if it's the full amount we requested, but we do feel good. You know, communities impacted by the fentanyl crisis, specifically Spokane, where our trend shows more overdoses than the national average, is something that our representatives are not quiet towards. So anticipate some good, positive movement in that end. Just don't know how much. So all great news for our region in terms of maintaining existing services, but I still defer to our MCO partners if and when there are cuts as to what does that mean for their network adequacy. But that is my not short report back. And I turn it back over to you, Kim.
Got it. Justin, thank you. Any questions or comments for Justin?
I just want to say thank you for all the championing you do, Justin. I know how hard you work behind the scenes, having seen that. And I just think we're just fortunate to have you leading this.
Yeah, very much so. All right. Let's move on to Tom, Consumer Consultation Panel.
After my CCP minutes from March and April, first we'll do March. At this meeting, our guests were Kaylin Roy, liaison between BHASO and CCP, and Gail Kogel, the Office of Behavioral Advocacy. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Gose, Aaron Smith, Robin Segner, Sarah Leek, Rose Plorday, and Ann Simmons. Sophia Alexander was absent. The online or in-person March 2025 CCP meeting was called to order. The February 2025 CCP meeting minutes were read and approved. There was no February 2025 Behavioral Health Advisory Board meeting, so this was not reported on. We discussed the CCP stipend checks. Kellen said that he will receive an update about this later on today and said that CCP members are a priority. We discussed the CCP budget. Sophia was not here to inform us about buying new CCP t-shirts. However, Sophia had said that she thought the best place to purchase the shirts was from Staples. The shirts at Staples cost $5 to $27 a shirt. Sophia also said that she would follow up on buying shirts at Burnett's. It was known that the CCP has $50 from the CCP Santa Picture event, and the CCP has photo paper and frames. We just need candy for the next Santa event. The CCP also discussed the CCP Facebook page and new membership. Robin said that the Facebook page is okay and that she's going to set up Jaunt and June stuff this week. The Jaunt is a walk-in event put on by the CCP. She said that she would like to pass out Anne said that she would like to pass out Jaunt flyers at her church. Also, Rose said that she has a friend who might be interested in becoming a CC member. We discussed the PACE program at SCC, People Accessing Careers in Education. PACE program may be closing on June 12th, and PACE may not be at the job because of this. The CCP would like to see PACE continued. The CCP tried to contact Ron Hain about continuing PACE, but hasn't heard back. It was known that the CCP will elect officers, chair, co-chair, and secretary in August. We discussed the Jaunt in June. Some possible vendors and participants for the Jaunt are Airring Club, Wellpoint, FBH, OBHA, NAMI, Special Olympics, Consumer Advisory Panel members, and Mayor Lisa Brown. We should buy the Jaunt's raffle prizes in May. Also, Kalen said that he will email Jaunt flyers to the CCP. The Jaunt is taking place on Tuesday, June 3rd, 2025 from 11 a.m. to 2 p.m. at the Frontier Behavioral Health Main Center of the Mayor Higgins building. Next CCP meeting will be held in person or online on Monday, April 14, 2025 from noon to 1 p.m. Meeting was adjourned. Now here are my minutes from April. At this meeting, our guests were Kaylin Roy, liaison to the BHASO CCP, and Gail Kogel of the Office of Behavioral Advocacy. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Gose, Aaron Smith, Robin Segner, Rose Plorday, Sophia Alexander, and Ann Simmons. Sarah Leek had an excused absence. The online or in-person April 2025 CCP meeting was called to order. The March 2025 CCP meeting minutes were read and approved. We discussed the March 2025 Behavioral Health Advisory Board meeting. At this meeting, Amanda Randall, a new board member, was introduced. She said that she's happy to be a BHAB member. She is currently with Zone, which connects with youth at the Northeast Community Center. There's a REACH, or Resource Engagement for Adolescents and Children update. Introduction and update by Jeanette Haynes, a REACH program coordinator. REACH gets referrals from Spokane County. This program deals with youth with behavioral health issues and gives youth resources and support. The program has a steering committee which tries to get a feel of where youth want to go. The program rolled out last year, and as of December 2025, had 401 psych visits. They have had 33 referrals since the first of the year. Also at this meeting, there was an administrative update. First, there was a Behavioral Health Advisory Council, HAC, presentation by Jessica Thompson. This is a statewide BHAB. It seeks to collaborate with other BHO, and BHAB services. At the next BHAB meeting, the Spokane BHB can decide if they want to participate. There was a crisis data dashboard update by Katie Royce. At this time, there were 156 high utilizers, 7,003 regional crisis hotline calls, 5,302 total individuals served, and 20,078 total service provided. There was a legislative funding update by Justin Johnson. He said that there is uncertainty in funding which could affect services later on, but is too early to tell. And he said that Spokane has to. He also said that Spokane had to return $10 million, but didn't have to limit services. Hopefully, Spokane will continue with services. Spokane is not taking on any new programs because it could cut other programs. Justin said that 2 facilities for involuntary treatment in Central Washington are closing, and there's not enough facilities for involuntary treatment. Justin also mentioned the state wants opioid recovery centers to stay open. Justin said that there's a bill in the state legislature having to do with licensing certified peer counselors, and that there is an interest in treating and funding mental health issues the same as physical issues. Justin also mentioned that the Spokane BHAB and NAMI Spokane are invited to make a behavioral health proclamation and should move by September to speak up. The CCP didn't discuss their stipend checks. Killen said that we should be looking for our March check to arrive soon and look for the April check to arrive later on. Killen mentioned that the CCP can check up on stipend checks. We discussed the 2025 CCP budget. The purchase of new CCP t-shirts was discussed, but later on in April, the CCP had received notice that the funding for the shirts was not available. We discussed the jaunt and tune, a walk-in event put on the CCP. It was noted that we should do the chopping through the jaunt in May. Also, Rose said that a guardian could come to the jaunt and let people know what a guardian does. Brent said that we put up jaunt flyers at FBH, the Mary Higgins building. Robin said that there is a jaunt flyer on the CCB Facebook page. Aaron said that she would go and contact the mayor about the jaunt. Rose said that she would try to get Special Olympics to attend the jaunt. Ann Simmons then asked if there's any way to contact people for help for children with mental health issues. Gail said that in the Northwest Behavioral Health has beds and can help, but that if the child is under 10 years old and needs a bed, he or she will have to go to Boise, Idaho. He also said that REACH, FBH, and Excelsior can also help, but she repeated that beds are not available in Spokane for children under 10. Next CCP will be held in person at the OBHA building or online on Monday, May 12, 2025 from noon to 1 p.m. Meeting was adjourned. Those are my minutes.
Tom, thank you. Any questions or comments for Tom? All right. Let's move on to finish up here. Board member or public comments? Comments from anyone present, I guess. We'll just say thank you all for being here today. Appreciate it. We will meet again Monday, July 28th, 2025. So again, thank you, everyone. Enjoy the beautiful weather. Take care of yourselves.
Tim, just one other thing.
Yeah.
We board members, we come in tomorrow and we will be meeting tomorrow.
Say one more. I'm sorry. One more time.
I heard. Does the board members only meet tomorrow? Is that it? Did I understand that correct?
To be honest, I'm not sure what you're referring to.
I thought that there was a with the emails that were coming through the board members, but maybe that's just what we've done today, and then
Okay.
we're not meeting tomorrow. Okay.
It might be. I'm not aware of anything, but in fairness, am I missing something?
No, I think that I misunderstood.
Okay.
Thank you.
Kim, what I think Jackie's referring to is the Board of County Commissioners will be voting on some of our projects tomorrow. They specifically will have the authority on that. However, the BHAB is meeting prior to that vote tomorrow. That's what this is. It's about today. And then the BOCC, or the commissioners themselves, different board, will be voting on what you just approved.
Thank you for clarifying. I appreciate that. Okay.
Any other questions, comments, words for the good of the group? All right. Again, everyone, thank you. And we'll see you again in 2 months. Take care. Bye-bye.
Thank you.